I like asking patients, what are the 3 to 5 things that if you do it, it makes you feel better? What are the 3 to 5 things that you do, if you do it, it makes you feel worse? With that, based upon what people tell me, I know, is it more neurological? Is it more immune? Because at the end of the day, when I look at chronic fatigue syndrome, those are usually the two underlying buckets. If I had to bring everything together, it's neurological and immune. If I had to put a third, it'd be mitochondrial dysfunction. But, a lot of people are like, well, what about the gut? Well, I put the gut underneath immune system. So there's a lot of umbrellas where things can go underneath, but it's getting all of those, piecing it together lets you know where you need to be. So, for example, if someone tells me, well, every time I have a menstrual cycle, or I get stressed, or I'm getting sick frequently, then I may say, well, this is inflammation and immune mediated response. Versus someone's like, well, I get a little bit of issues with that, but what I find is driving in a car, being in a busier environment, being on the computer, that is what destroys me. Now, that's telling me way more neurological. But in the end of the day, it's about looking at a variety of different metrics and markers to identify the patterns. And the more things that can be identified, the easier it is to identify the pattern that needs to be addressed for an individual. Up front, everyone should be evaluated as 50-50. But the testing then says, hey, maybe you are actually 70% immune system, 30% neurological. Or maybe you're 70% neurological, 30% immune. And this is super important because if you don't know which part of the process should get the most attention, if you do the right thing in the wrong order, you don't get the results you're looking for. So if you think about like cooking, doing too much, too little doesn't give you the outcome. Also doing things out of sequence also doesn't give you the outcome you would like. And this is where working with the ninjas, and specifically the ninjas who combine functional medicine with neurology, is the most important thing to do. But even just a regular functional medicine ninja can be a great place to start off. But if you feel you're stalling and you're not getting to where you need to be, whether it's 3 months or 6 months down the road, then it is worth considering and getting that neurological evaluation up front, because it does allow more predictability for what needs to be done. Because there's nothing worse than getting a year or two down the road and finding out that you bombed the neurological testing, and have that been addressed, you would have been better in 3 months. But now you're a couple of years down the road, and it's like, yep, that's why nothing worked, because this part was completely ignored.